So let's start off with some of the top respiratory illnesses that we're seeing this time of year.
Well, it really mostly like any other year. We're certainly seeing colds. Allergies are going to be on the downslide right now. They tend to be more in the spring, summer, and then a little bit in the fall. But as things get colder, we actually see a decrease in allergies. Of course, what makes this year so much different is our unfortunately increasing levels of COVID-19.
Absolutely, and that makes sense with the allergies. And say you wake up one morning, you're really not feeling well. Is it COVID, the flu? Is it potentially lingering allergies? What is that process of elimination there that people should be doing or thinking about?
There's a few ways to distinguish between these different conditions. I will say up front that it's not so easy to distinguish between, particularly early on, influenza, the regular seasonal flu, and COVID-19. There's a tremendous amount of overlap in those kinds of symptoms. But that said, when we talk about certainly colds and allergies, and it's important if we're trying to help people figure out should they seek medical attention. And let me say that if someone feels that they need medical attention, they should go get medical attention. They shouldn't be afraid of going. Doctors' offices, hospitals, emergency departments are being very careful about protecting patients in these unusual times, even more so than we do on regular days. But in terms of colds and allergies, I mean, the biggest clue I will offer up in terms of allergies, and people often overlook this, is this something you've had before? Does it happen around this time of year? Or if you're around these kinds of triggers, things like pet dander from cats and dogs, and ferrets for that matter, and cockroaches also are a big trigger for allergies. But then there's also environmental allergies, things in the air from pollens and grasses. And again, those sorts of things are going to be tapering off this time of year. But is this something that happens to you all the time? I mean, is it every March you get this runny nose? That's a big piece. Allergies and colds tend to be relatively mild. They're annoying, they're incredibly unpleasant, but people tend not to feel really beaten down by those kinds of symptoms. Distinguishing between the two, again, if you've got experience with allergies, things like the itchy eyes and sort of the constant clear runny nose, very common with allergies. With colds, you tend to feel very congested, particularly in the nose, and not so much down in the chest. Mild cough, but not really producing anything. And those things can generally be treated in adults with over-the-counter medications. In very young children, younger than school age, the evidence is pretty clear that those over-the-counter medications typically don't help very much. And there are some side effects from those. So in very young kids, we recommend not using over-the-counter medications for colds. The other big indicator is fever. Occasionally people can get a mild fever with colds, but if that fever is particularly elevated, we're talking about 101 Fahrenheit or more, that's not something we usually see with a cold or with allergies. So that pushes us more toward whether this is the flu or pneumonia potentially. So when we start talking about those other more significant illnesses, the flu, pneumonia, we're talking about really feeling much, much sicker. People with the flu tend to have a lot of body aches, tend to have a lot of fatigue. Again, it's the same kinds of respiratory symptoms with the cough, often a runny nose. And again, I made reference to the fever already. Pneumonia is much more chest-based symptoms. You can get some runny nose, but it's really about that cough that comes from deep in the chest. And pneumonia much more likely, doesn't happen all the time, but much more likely to have a productive cough. You're actually coughing something up. I would caution parents that children tend not to cough things up. They tend to swallow that before we ever see it, but you can often hear that. You hear that rattle as opposed to that dry cough.
I see. And then when it comes to distinguishing that between COVID, where does that come into play?
Well, again, the distinction between COVID and influenza is very difficult on a clinical basis. That's something for which we really need to test. And one of the things that's really important about this that can help not just to make the distinction, but to prevent people from dealing with those more significant illnesses those for which they may need to seek medical attention, whether it's influenza or COVID or pneumonia, is preventive measures. It's really important that folks who are eligible get vaccine for influenza every year, and it's really important that folks who are eligible get their immunization for pneumonia. And I will say the CDC has excellent information on their website that defines who should and shouldn't get it. And there's actually a very small portion of the population who meet the age requirements, but otherwise shouldn't get it. So, really, if you meet the age qualification for influenza, that's just about everybody outside of infants. It's something you should get, unless you've had a life-threatening reaction to one of the components of the vaccine. It's highly advisable for you to get it. Now, it's important for folks to understand that the vaccines are very good, but they're not 100% effective. No vaccine is 100% effective. And if folks are looking for one thing that will prevent influenza, will prevent pneumonia, will prevent COVID, they're going to be disappointed because we won't find that. And the key is really to do as many of the things as we can to layer on top of one another to decrease the risk. And certainly we've heard a lot about that with regard to COVID this year. We do not yet have an approved COVID vaccine, but there are a lot of things that we can be doing to prevent our risk of getting COVID-19. And that includes certainly mask wearing anytime that you're out and you're around people who don't live in your household. It includes social distancing. It includes minimizing the amount of time you spend out only to the essentials. And that's frankly why we're having this conversation this way rather than in the studio somewhere, because we can make this work. Is it ideal? It's not, but we can make this work. And this decreases the risk to you and to me of the transmission of COVID-19. That carries over to things like influenza. We would expect that if people are following the guidelines to decrease the risk for COVID, we should also see some decrease in transmission of influenza, which would be a great thing. It's a serious disease, and it does cause deaths in this country every year.
Absolutely. And, kind of touching back on the immunizations, how does that affect, not overwhelming our hospital system, especially as we're trying to fight COVID right now, especially with the flu vaccine?
Well, again, just with as it is with about everything else, prevention is always better. If we can prevent someone from getting sick, if we can keep someone healthy, or even if the vaccine isn't 100% effective to prevent someone from getting sick at all, but it can decrease the severity of the illness, then that decreases the pressure on the healthcare system. If somebody has mild flu symptoms because they got a vaccine, and although it didn't prevent them from catching it entirely, it made the illness very mild, for one, they won't need any serious intervention, and perhaps more importantly, they won't be down as long. They'll be able to get back to their lives. They'll be able to get back to work. They'll be able to get back to their family and those sorts of things. So that prevention, I can't emphasize that enough. To take the steps that we can, get the immunizations unless you have one of the very few conditions that make that something that you shouldn't take. And again, the CDC's webpage has a great information. It's very clear about the conditions that someone should avoid those vaccines or even consider avoiding those vaccines and discuss with their healthcare professional.
And kind of touching back on, COVID and the flu and kind of that fine line between them. So say you are experiencing some of those very similar symptoms, and like you said, it kind of comes down to testing. If somebody is feeling that, though, is that a situation where they go get a test on their own, they call their primary care physician, how would they handle that?
Yeah, the best thing, if possible, is to coordinate through their primary care physician. A huge number of primary care practices have telemedicine available, so you may be able to do this exactly as we're having our conversation now and be able to make that decision about how to go about doing that. Whether someone heads to any of the sites that are offering COVID testing, or if they come into the office to be assessed first and potentially tested there if the testing is available in that office. So keeping your primary care provider in the loop and working with them collaboratively is always the best way to make sure that you're getting the best care. And also, you may have mild symptoms now, and they can give you some indications about, all right, what are the thresholds for when you should call me back? Now, I will say that people should look out for more severe symptoms. Very high fever that's persistent. We're talking fever over 100, 200, 2.5 Fahrenheit. In adults, kids tolerate a bit higher than that. But if it's persistent, I mean, if it spikes up one day and then comes down and they're feeling okay, I don't think they need to get too worried. But if it's persistent over a couple of days, they probably want to have somebody take a look at them. And again, reaching out to their primary care provider is a good way. If they have any difficulty breathing, mild cough is one thing, but if it's actually hard to breathe, they want to get themselves seen. Folks with flu can have aches and pains all over, but if somebody feels severe chest pain, particularly very localized chest pain in one spot, they definitely want to come in and make sure that they're evaluated. That's something that's pretty consistent with a pneumonia. So we want to make sure to rule that out if they're experiencing those symptoms. So those are really some of the big ones that would trigger someone to reach out and have themselves evaluated by a healthcare professional.
It really seems like having an open communication with your primary care physician is a good way to handle flu season, pneumonia season, and the time of COVID.
Well, it's a good rule all the time. The better your communication is with your primary care provider, the better you can anticipate what you need to do. Make sure that you get sort of locked into preventive care for normal screenings that you're going to need. We all need as we get older. Routine screenings to identify things before they become a problem. That kind of open communication is incredibly important. And that really is the role of the primary care provider, whether it's a pediatrician like me, or it's a family medicine doctor, or an internist, or for older folks, a specialist in the elderly, a geriatrician.
And let's talk a bit about flu season in general for this year. From your point of view, how has that been going so far? Has some of the COVID precautions and restrictions impacted the impact of flu season at all?
I think it's a little early to say. We're just really getting into the time for the regular flu season. So I wouldn't hazard a guess at the moment. Again, from a theoretical standpoint, if folks are doing the things that we've been recommending that they do to decrease the spread of COVID, it should also help to decrease the spread of influenza.
And so it seems like this is really the time to be on the lookout if, as we head into flu season, to make sure you understand the different symptoms and what they may be.
Yeah, absolutely. And again, taking those preventive measures that are good for all of these to reduce the risk of all of these conditions, getting an influenza vaccine, getting a pneumonia vaccine, if you qualify for those, that's really important. And when I say qualify, that's a medical determination based on your age and your medical conditions and things like that. Folks can find all that information at the CDC's website.
Is there anything that I didn't ask about that you think is really important for our viewers to understand as we deal with COVID and the flu and pneumonia and all of that?
Again, I'm going to risk sounding like a broken record here. The two biggest things are, one, take the preventive measures that you can. Wear a mask when you're out, social distance, decrease the amount of time that you're out to those things that are absolutely essential, and get the vaccines that you need for influenza or pneumonia or both. And then the other is, if you feel like you need to be assessed by a healthcare professional, do it. Don't wait. It's okay. Everybody's taking precautions to make sure that patients and staff and the professionals are safe. And we want to make sure that people are getting the care that they need before things get really bad. So those are the most important messages, I think.